This is a medial knee dive test. That is a test that's commonly done in our office for anybody that comes in with any problems from their back down to their foot. In this scenario, we're kind of looking at the knee. So all you're going to do, and this is really helpful if you have a mirror to kind of do it in front of, because then you can kind of see the position of what's going on in your hips, your knee, and your foot. But basically, you're going to stand on one foot. If you can't safely stand on one foot, you can have a pole or a chair somewhere to kind of do this test. But if you can, you're going to stand on one foot, and then you're just going to do a single limb squat. So you can keep foot out in front, you can put your foot behind you, whatever is more comfortable. Just making sure that as you're looking in that mirror, you can see what's going on mechanically at your hips, your knee, and your foot. So what we want to do is just kind of do a squat. So we're not doing like a full deep squat, like a pistol squat of what we would call. You're going to just kind of go down, lower your weight down closer to the ground. And what we want to look at is what happens at your hips, your knees, and your foot. So what should happen is your foot should stay fairly stable. Okay, so that shouldn't move around a lot. Your balance, you should be able to maintain this. If you're bending down, your foot is collapsing a lot. The problem with that is when your foot collapses like that, your knee has no other alternative but to dive in. And this is what we're calling, that's why we call it the medial knee dive test. We don't want this knee to kind of dive in like that. Ideally, what we would see is that foot would stay stable, your knee would go down, it would stay over the outside part of your foot, kind of like that second or third toe, where if you look down, you should be able to see your big toe. If you can't see your big toe, if your knee is blocking that, that means the knee is in a little bit, and that's not a good mechanical position for your knee. So foot stays stable, knee over the outside of the foot, and your pelvis stays level. So some people do a pretty good job at the foot. They can keep the knee over the outside of the foot, and then they kind of lose it at their pelvis. What that indicates is that the muscles in the back of the hip, your external rotators and extensors, are not doing the job that they need to do, which is to stabilize the femur on the pelvis. So what happens is if you go to bend this knee, sometimes you'll make one of two compensations. Most people will kind of dive in like this with their pelvis. So I'm holding this pole here. If this was like a level that you would put right on your belt, you'd want that to stay nice and level. But what usually happens is you get down to that knee bend, and then sometimes you get that opposite hip drop. And that's because the muscles on the outside of your hip are not doing the job that they need to do in order to stabilize your pelvis. So the other compensation that will happen is people will kind of throw their weight over to the other side. And still, this thing is not level. We want this thing to be nice and level. You can kind of make a compensation like that and kind of think you're doing okay with this test, but unless you can keep this pelvis nice and level, then doing that test indicates that, again, there's some weakness in the outside of the hip. And the problem with that is when you go to bend that knee, and you might say, well, I don't do a lot of single limb squats during my day, but you actually do. If you go up and down stairs a lot, and certainly if you're walking, you spend some amount of time with all your weight on one side. So if you're not doing well with this test, it's an indication that the muscles are not strong enough to stabilize all of the joints from your belly button down to your foot, put your knee in poor mechanical position, and can cause irritation in the knee.